Okay, well, we're recording this at this point, and looking back on the last time we had a Zoom mentoring meeting, we covered quite a bit of ground as far as previous pandemics in the past. And the main thing that I want you to get from that is that the world, as bad as this seems, the world and humanity has gone through this before. And in time, things got better. And that's the hope and that's the attitude that we want to deal with this pandemic with. That it's kind of difficult to deal with as we going through it, but realize that in time, things will get better. What do you think is going to be necessary in order for this virus to no longer to be a pandemic and to become a manageable health concern?
A lot of social distancing.
Uh-huh.
Way more washing your hands if it gets a little bit worse.
Mm-hmm.
We're probably gonna have to start looking for more things to like clean up the house and probably like don't go far from the house just in case, like if you're going to take out the trash or something, you don't and you wanted to go to Walmart for some toilet paper or something, probably don't go to like a far Walmart or something.
Okay, just stay close to home. And that's part of that, what we call sheltering in place, where they recommend that people don't go out no more than they absolutely have to. And it's almost like waiting on a storm to pass over. You don't want to go out while it's, a tornado or a storm is, cutting up. You want to wait till the storm pass before you go out. So you shelter. Who do you think is responsible for your health? Okay, hold on 1 minute. Let me say goodbye to my grandkids getting out of here. See you. Who's responsible for your health and well-being, do you think? Is it your teachers? Is it your parents or guardians? Is it your caregivers? Is it your school administrators? And if you work a job, is it your employer? Is it your doctor? You live in a city? Is it the mayor, governor, the president? Who's responsible for your health?
Basically the president, because he like spells out to the world what you have to do not to get it or to stay away from it. And your doctor, just in case you have like a sign of it, they give you medicine to stop the signs from showing up. And basically your parents, because they tell you what. Basically my parents and my because for me they tell me what to do and what not to do. If this ever happens.
Now, those are all good answers. But the thing I want to impress upon you is that no matter what type of direction the president states for the country, if he makes it a law saying everybody got to wash their hands 10 times a day, if he makes it a law saying people have to stay in their house 20 hours out of the day and they can only go out 4 hours a day, if he makes it a law that says if you get caught being more than 6 feet apart from somebody, then you in trouble. And even with your parents can tell you, wash your hands, Troy, wash your hands, social distance, Troy, and don't go out of this house. And if you get sick, the doctor can tell you, here, take this medicine or stay in bed, get your rest, eat and keep your immune system strong. But irregardless of all that, the main person that is ultimately responsible for your health is you. Because people can tell you and give you good advice and tell you good things to do and not to do to stay safe. But if you don't do it, you see what I'm saying? Then that's all for naught. So irregardless of all the good advice and instructions and directions and orders from your parents, It's basically up to you to do it. I mean, sickness and death is bad enough, but are there going to be some other bad things that we're going to have to go through? Some other difficult things that we're going to have to go through to survive this pandemic, or as a result of this pandemic, you think?
Like if there was a place where it have less people with the virus, it would spread like there.
Okay. What do you mean by less people?
Like if there was a place with 45 people that have the virus in a city, it would spread there.
Okay. And some people are stuck in different environments where there's a whole lot of the virus and sickness around them. And I kind of think about nursing homes, people that live in nursing homes. A lot of our nursing homes have a whole lot of cases of people sick with the virus. And they don't have the option of saying, okay, I'm out of here, I'm going somewhere else, because that's the only place they got to stay. And so that there's a bad thing to deal with. Just like now, with different daycare centers being closed, they don't have nobody to watch their kids. So a lot of people aren't able to go to work because they don't have childcare, nobody to watch their kids. And then a lot of people are having to go on unemployment because their jobs closed down because people can't come out and aren't coming out to buy stuff. People that work in restaurants, and when they closed the restaurants down, those people were out of work. How long do you think you can go without working? Or how long do you think your parents can go without working before things got really tough?
So like if they get paid a lot of money, and they saved it up and like started figuring out a way to make more money, we'd probably last about 8 months. 8 months.
That's a good position to be in. If you have enough money in your savings to last you for 8 months without any money coming in, that's a beautiful situation to be in. But unfortunately, most people live paycheck to paycheck. And by that, I mean they don't have no money saved in the bank. And they count on that next paycheck to pay all their bills and buy food to eat with. So that kind of lets us know, one lesson we learned from this is the importance of having something set aside for a rainy day. You heard that expression before? Saving for a rainy day? Well, a rainy day is basically another way of saying adversity, for troubling times when people don't have the income coming in. That's a rainy day. You lose your job, that's a rainy day. You get sick and not able to go to work and you ain't able to make no money coming in, that's a rainy day. Whatever disrupts your life to the point where your income is no longer coming in can be considered a rainy day. So it's always good to have something saved up, an emergency, something come up, unexpected. Nobody expected this virus to come in, but it affected everybody.
Hold
Just
on,
like,
there's a bug in my room. Give me a second.
knock it out, Troy, knock it out.